The pathophysiology, classification and treatment of vaginal prolapse in cows. For the pathophysiology, in the last trimester of pregnancy, relaxin increases, as well as estrogen increasing, which causes vaginal prolapse. There are 4 grades, grade 1, 2, 3, and 4. Grade 1 is intermittent. It's visible when lying down, and the animal retracts it when standing up. Grade 2 is continuous, but there is not major tissue damage. The urinary bladder can be retroflexed, which causes urination problems, and it's easy to replace. In grade 3, the cervix and almost the whole vagina is prolapsed. There is major irritation and local edema and hyperemia, as well as blood vessel compression. It's difficult to replace. If the cervical seal is disturbed, there's a risk of a septic abortion, which means you need to do a C-section. And if the fetus dies, there will be signs of toxemia. In grade 4, there's a prolonged prolapse. It's essentially a grade 2 or 3 with infection, trauma, and necrosis. There can be possible adhesions with perivaginal tissue and the bladder. If it's subacute, it's replaceable, but if it's chronic, it's not replaceable. Euthanasia needs to be done on the animal. For the treatment, give epidural anesthesia and clean and disinfect the prolapsed part and the surrounding parts. And then use hygroscopic powder, which is sugar and sulfonylurea, to decrease the local edema. There is the Flessa method and the Bunner method. With the Flessa method, pierce the vulva on both sides with special pins and let the ventral third part be intact for urination, and then remove the pins after birth. With the Bunner method, use a Bunner needle and have an antibiotic-soaked tape. Have horizontal skin incisions dorsally and ventrally of the vulva, and then insert the loop and take skin under the vulva upwards around the vulva, and then stimulate the constrictor vestibular muscle. Then tighten the suture and let 2 to 3 fingers in the vulva, and then do a bow knot to maintain the closure. And then close the incision with interrupted sutures. This method makes it easy to open for birth. When lacing with a mattress suture, have a widely placed mattress suture encircling the vulva vertically and place the quills of rubber. Have vertical or horizontal mattress sutures and then remove when it's time for birth. It's simple and easy to remove and no special equipment is needed. For the Caslix procedure, close the vulvar lips with a vertical mattress suture using non-absorbable stitches, and then open it when it's time for birth.